Dr. Peter R. Breggin conducts a private practice of psychiatry in Ithaca, New York, where he treats adults, couples, and families with children. He also does consultations in the field of clinical psychopharmacology and often acts as a medical expert in criminal malpractice and product liability lawsuits. He has been practicing for over 40 years and has written dozens of scientific articles and many professional books, including Medication Madness, The Role of Psychiatric Drugs in Cases of Violence, Suicide, and Crime, and he is on the editorial board of several journals. In 2010, Dr. Breggin and his wife, Ginger, formed the Center for the Study of Empathic Therapy, Education, and Living, which emphasizes caring, understanding, and empowerment as tools to help people deal with personal conflict and suffering. The center will sponsor an annual meeting in April in Syracuse, New York. Dr. Peter Breggin, welcome to the Global Freedom Report.
Oh, it's just a pleasure to be here. I've actually been looking forward to this, Brent.
Well, thank you. I appreciate that. We've been looking forward to speaking with you as well. You practiced in Washington and Maryland for a time. Overall, you've been a psychiatrist practicing psychiatric medicine for more than 4 decades. What kind of changes, and of course I mean in general, what kind of changes have you seen over that time period in the attitudes of your patients, especially children? Are there any patterns of behavior or treatment that you can point to that are apparent now but not back then, or vice versa?
Well, I actually became heavily involved in psychiatry when I was 18 years old. So I've got a long span going back to 1954. In 1954, I started volunteering as a college freshman at Harvard in a state mental hospital. And over the 4 years, I actually directed a very innovative program, the Harvard Radcliffe Mental Hospital program. We wrote a book about it. I lectured about it around the Northeast. So I got started very early. So I have a big span of seeing changes from when the state mental hospitals were virtual snake pits, unruly, out of control, to later in the 50s when everybody got drugged on the drugs like Thorazine that just quieted everybody down and basically lobotomized them.
How would you characterize the differences, both in the problems you see and in the treatments that tend to be recommended, from when you started to when you to today? In other words, there's clearly differences. How would you characterize them? Oh, in less than a minute. We're coming up on a break.
Well, it's worse than you think. What's happened is that the treatments that used to be reserved for the state mental hospitals, which is shock treatment and drugging everybody, has now become the treatment of children in the schools and adults out on the streets. Literally now, the old-fashioned psychiatry has come to dominate all of psychiatry today. It's all biological. It's all drugs and shock treatment.
Drugs and shock treatment just makes you feel just like getting in the car and going down to the psychiatrist today, doesn't it? My guest is Dr. Peter R. Breggin. You're the author of Medical Madness, The Role of Psychiatric Drugs in Cases of Violence, Suicide, and Crime. Too often, investigations after the fact find that crazed killers or mass or serial murderers have been taking prescribed antidepressant or antipsychotic drugs. I remember that we found that one of the killers in the Columbine school shootings had 3 months prior to those tragic shootings been the subject of experimentation at a government laboratory in central Pennsylvania where he was fed psychotropic drugs. How much of a factor, and is there any way to really tell how much of a factor are drugs in these extreme incidents?
Well, they often play a role, but not always, obviously. You're talking about Eric from, right. I don't know about that experimentation, but he was on Luvox. I was a medical expert in a couple of Columbine cases that didn't go to trial. I saw case records, and with certainty, Eric was taking Luvox and had a, quote, it's so ironic, therapeutic level in his blood at the time of autopsy. And drugs like Luvox, which is similar to Paxil, Zoloft, Prozac, definitely cause violence and suicide. And my book, Medication Madness, has a lot of cases. There's another twist on it, though, with your concern about children. Not only do children become violent on these drugs, they become suicidal, and they kill themselves. At our conference in April, the Empathic Therapy Center, we're gonna have a parent who lost a child to one of these drugs, and the lawyer and myself talking about one of these cases. And more than that, even when the drugs work, Brent, how do they work? They don't make any child normal. Drugs don't make people normal. All they can do is suppress and control.
Well, let's talk about that. Talk about children. Let's talk about me for a moment. I want to give you a personal example. When I was in public elementary school, I used to ask why about everything. I simply did not accept something just because a teacher said it was so. And as a result of my constantly expressing my inquisitiveness, I was labeled by school officials as being a disruptive influence. Ultimately, they actually kicked me out of school because I asked too many questions. If I attended school today and behaved that way, they would pump me full of Ritalin to calm me down, which in turn could well have stunted my intellectual and spiritual growth and interfered with my life's accomplishments. How bad is the problem? How extensive is the problem of drugging our children to make them normal, whatever that means?
Well, probably 20% of our children, a huge figure like that, will be taking psychiatric drugs at some time. Certainly 10 or 12. It's a huge number. It may even be larger than I'm estimating. But I know what would have happened to you, Brent, because when you got Ritalin, it wouldn't have been enough to stop you. So you would have gotten more upset and more angry. Then they would have ended up putting you on 3, 4, or 5 drugs. I'm seeing 12-year-olds on 3, 4, and 5 drugs. And they're stupefied, they're agitated, they're confused. It's a very, very severe problem. And also our young servicemen. I recently testified before the House Committee on Veterans Affairs because our young servicemen, for the first time in history since the Iraq War, are being given psychiatric drugs and sent into battle on them, into combat conditions on multiple psychiatric drugs. It's really a disaster.
I'll tell you something. That does not make me feel more protected or anything like that.
Oh, God, no.
Oh, my God.
It's terrible. We're giving our soldiers drugs that cause disinhibition, violence, and suicide. We give them 180 days of drugs when they go into combat where they'll have no medical supervision at all. And we're giving them drugs where the FDA says they should have practically daily supervision.
That's probably how we get them to do the things that they do. People say, I can't imagine how our soldiers do this. Probably they are so mind-numbed, that they just do what they're told. I want to go back to the children for a second here. How you said that you've come across children being pumped full of all kinds of different drugs by the age of 12. How young does this start? Like with me, I only was in public school through 4th grade. So what was it? I guess it was about 9 or 8 or something like that. How young would they have started putting stuff into me?
There are Harvard professors like Biederman who have been advocating children of a very early age. We had a disastrous death in Boston of a 2-year-old who was on adult psychiatric drugs. They're starting as early as they can. It's a disastrous situation. Psychiatry is never controlled from within. It only gets controlled by outside pressure. It has an impulse of its own to expand, Brent. It's a very disastrous situation. We have a lot of shock treatment being given to the elderly, especially elderly women, because it can be done, because they're covered on Medicaid, Medicare.
But wait a moment.
They can't defend themselves.
Psychiatry is a medical practice. Aren't there checks and balances that say you just don't give children so young? There's a certain level, a threshold of what you do and what you don't. Isn't there something out there? It sounds almost like that some people are getting ideas and just following them to extremes and nobody's there to stop them.
Oh, that's totally the case. For example, the FDA may approve a drug for adults only. It'll still, under the law, physicians can give it to children, and they can give it to any age children they want. They're only the only thing that they fear are malpractice suits, because it's very, very rare for the medical profession to chide one of its own for giving any kind of treatment. Brent, the only reason we don't have lobotomy today in widespread use is that I took 5 years out of my life in the early 70s to conduct a campaign to stop lobotomy, and I was opposed by the AMA, the American Psychiatric Association, the National Institute of Mental Health, and the VA, all of whom had their hand in it one way or another. If the psychiatry needs outside pressure, it's a fundamentally anti-libertarian force because it grows on involuntary treatment. For centuries, we had innumerable people locked up in state mental hospitals. Now it's even worse. They've pruned down the size of the hospitals and created outpatient commitment so that you can be in your home and be forced to go to the clinic to get drugs under court order, or they'll come get you. So it's a situation where psychiatry is just used to being outside of the law. Why they call it civil commitment is to keep it outside of the criminal protections. Not a good situation with psychiatry.
No, indeed. It seems like every behavior these days is assigned the name of a condition or syndrome. What we used to call impatient, today we call ADD or ADHD or ABCDEFG. Once the behavior has a name, we can then prescribe drug treatment, all of it to presumably bring the subject back to a state of normality. So, according to the medical journals and pundits, what is normal today? And what I mean by that, what kind of behavior would result in a modern American doctor saying, this person needs no treatment, he or she is normal? What is normal?
Brent, you're not going to believe this, but if you go to a psychiatrist's office, it's assumed you're abnormal. Almost no one escapes the first visit to a psychiatrist without medication. Any human being, especially if you're upset enough to seek help, has got rough edges, and that's all you got to do is show a few of your normal rough edges. We have children on these stimulant drugs, which are addictive. They're described and scheduled by the DEA as addictive simply because their grades aren't as good as their parents want them to be, and a pediatrician is willing to go along with it. The situation is really quite out of control with drugging. The antidepressants, the more we study them, the more my original claims in talking back to Prozac, which is one of my earlier books, have been confirmed, which is the antidepressants, if you really look at them, don't work. But people can't come off of them because the withdrawal is so painful that it's a major deal to come off them. So we have, at times, 15% of the population in a year taking antidepressants, which we now know from meta-studies probably don't work at all, but which cause horrendous side effects, but the folks can't get off of them. You really need a lot of help to get off those drugs if you've been on them for a while. It's a really very bad situation. And the reason it's bad is it's fundamentally, I think, against the whole notion of what is a human being. This country's founded on the idea that human beings are spirits, they're souls, they're dynamic, they have freedom, they should have freedom. Psychiatry is based on the materialistic notion that your problems are in your brain, that they're biochemical. It's just a philosophy. It has no proof. And that philosophy empowers the use of drugs and bamboozles all the intellectuals who think that it must be true. There must be a biochemical imbalance when it's never been shown in any psychiatric disorder. So our culture has within it this anti-libertarian, anti-liberty, anti-person kind of concept that if your kid is acting up, it's not a family problem, it's not a discipline problem, it's a biochemical problem. We can drug the child. And it makes no sense. All the problems children have are about family life, they're about growing up, they're about school life, and we need to retake responsibility for our kids, Brent. We need to say we're responsible as adults to bring them up, as teachers to teach them, as coaches to coach them, as ministers to give them spiritual guidance. All that's given up when the child doesn't look like every other child or has a little problem and is declared to have a mental disorder.